Hi, how may I help you?
Hi, I have an appointment here for my mom.
Okay, what's her name?
Bianca.
Bianca, last name?
Bias.
Bias. Can I get insurance, please?
Yes.
All right. Well, go ahead and have a seat and I'll be with you shortly.
Thank you.
Good morning. I'm Andrea. I'm the medical assistant, and I'll be taking your vitals for today. Who's our patients today? Bianca?
Yes.
I'm going to be checking your temperature. So today we have Miss Bianca Bias in the room with her daughter today. Her vital signs were normal. When I was assessing her vital signs, she did seem kind of confused.
Okay.
So just to let you know.
Okay, anything else?
No, I think that's it.
Okay, awesome. Thank you. Hey, I'm Hansi. I'm going to be your nurse for today. Who's Miss Baez?
She's Miss Bias.
Okay, can I have your date of birth, please?
It's June 24th.
Okay, and how old are you, Miss Baez?
And 55. No, she's 66.
Okay, and what is your relation to the patient?
I'm her daughter.
Okay, what brings you guys in today?
The checker.
The checkup. Okay. Is there anything else that you guys were concerned about?
Well, I brought her in because recently she's been forgetting everything.
Okay.
It started with her forgetting where she left the keys, and the most recently one, she called me because she was lost. She didn't know how to get home, and she was
driving?
Yes.
Okay.
And she was in the neighborhood. Yes, you were. I don't remember that now.
Okay, and how long ago was this?
It was like 2 days ago.
And when did you first start noticing that she would start forgetting stuff?
It's been a couple of weeks.
Okay. I'm just going to go ahead and take a quick look at you. Do you know where you're at right now?
We're at the hospital, right?
Okay. And do you know what month and year it is?
It's October 15th, 2011.
Okay. I'm just going to go ahead and shine a light in your eye. And how is she eating?
Because she forgets to eat.
Okay.
So
How many, do you know around how many times a day you eat?
I would say 3 times a day.
3 times a day? Okay. Okay, so I'm just gonna go ahead and let the doctor know she's ready, and then she'll be back for some further evaluation, okay?
Thank you.
So we have Miss Bayan in the room. She is 66 years old. Her lungs sound good, heart rate is good as well. She is pretty confused. Her daughter said that she brought her in because she forgets her name. And the other day she was driving and called her daughter and let her know that she basically didn't know where she was. She got lost. So little things like that. I was also asking her like what she eats throughout the day. If she eats, she said yes. Her daughter said no. She's not alert. She's alert. She's not oriented to place or time. She thinks we're in 2011.
Awesome. Thank you so much. Hi. Hello. My name is Noemi Sanchez, and I am the PA, physician associate. And I was speaking to my nurse. I believe I have Miss Bianca Paez.
Yes, she's
Yes.
Bianca.
I'm just gonna ask you some questions, if that's okay with you, just so that we can figure out what's going on and definitely try to help you the most, okay?
What was your name?
My name is Noemi Sanchez.
Oh.
Yes. Okay, awesome. So I'm gonna go ahead and have a seat if that's okay, and just ask you a few questions and just answer to the best of your ability, okay? All right, awesome. So Miss Bias, do you know what day it is?
Yes, it's October 2011.
Okay, and do you know where you're at?
You said where? Checkup.
Do you know where exactly you're at?
The hospital?
Okay. Do you know what city you're in?
Yeah, El Paso, Texas.
Okay, awesome, great, thank you. Do you know how to count from 10 backwards?
Yeah.
To-
You want me to count?
Yes.
It's 10, 9, 10, 9, 5, 3, 2, 1.
Can you spell your first name?
Yes, Bianca. It's a V, and then it's that next word. This is too many questions. This is too much.
I'm sorry.
Yeah.
We're almost done actually. Do you know what this is?
It's that yeah, I see it all the time. It's that the thing you write with, right?
Do you know the name of it?
Yeah, what was it? What's the name of the item?
It's a pen.
Yeah, a pen.
Okay. And what about, do you know what this is?
Do you know?
I know, but they're testing me.
I forget. I know the name.
Do you know what it's used for?
Yeah, it's for the numbers.
Okay. You just don't recall
Yeah,
what
I
it's
just
called.
can't remember the name. I know the name.
Write your address here. Your complete address with the zip code and everything, okay? Like you're mailing me a letter.
Okay.
Let me have the
Do you need my address? She can give it to you. She'll write it down.
Are you
Okay.
able to write it?
No, not right now.
Not right now? Okay. It's okay, I understand. Alright, okay, so are you able to put your right finger to your nose? Okay. Can you hold up the 7 fingers? Okay. And can you close your left eye? Okay. Okay. Well, that's all. What I'm going to go ahead and do now is I'm just going to go ahead and order an MRI. It's a diagnostic study just to check how her brain is. The nurse will come in and explain the process, the procedure a little more. And then I'll also ask my medical assistant to reschedule you. That way I get a chance to review everything. And then you guys can set up another appointment, and then on the next appointment we can go ahead and go over what we found and everything. Okay, did you ladies have any questions for me?
Yeah, why are we here again?
We already told you it's a checkup.
Okay, well, it was a pleasure, and we'll see you soon, okay?
Thank you.
Hello, ladies. Who I have here, Miss Hensley. She's the RN, and we're just gonna talk to you about, what we found. So based on the diagnostics, the MRI, her brain is showing some abnormalities, and based also on the mental status evaluation, I have come to the conclusion of the diagnosis, stage 2 Alzheimer's.
What's Alzheimer's?
Okay, so very great question. So Alzheimer's is a chronic progressive degenerative disorder. So it affects the cells in the brain, and it causes impaired intellectual functioning. So there's plaques in the cortex where the lobes are found, and then there's also tangles of mass of non-functioning neurons, and that affects the connection between the cells, and it causes cell death and decrease in brain cells. Okay, and I found that based on the mental evaluation, she would be stage 2. That's because she has obvious memory lapses, she was disoriented at the time, so she's unable to recognize familiar faces. Do you have any questions about?
Is it curable?
It's not curable.
It's not. So she's going to stay with this?
Yes, and it's going to progress.
Oh,
I'm sorry.
okay. And am I gonna get the same thing?
The research does show that if a family member has it, the probability of another close, immediate family member getting it is much higher.
And how do we treat it?
Okay, so the options are limited, but I will prescribe donepezil. It's going to help your brain to maintain your memory skills for a while.
First question, does she live by herself or who is she living with?
Right now she is living by herself, but I'm making arrangements for her to live with me.
Okay, at home, how has she been doing by herself?
I'm doing great.
Yeah?
No, she's still the same. She keeps forgetting everything.
Okay, and were you going to be at home all the time watching her? Was there going to be somebody else at home that was going to be watching
So
her?
I work, so I won't be able to be taking care of her.
Okay.
I don't need to be watched. I don't need to be watched.
Okay.
She does.
Usually what we recommend in these cases is to get a caregiver, just because it is going to take, like she said, some adjusting, and bottom line is she just can't be by herself. It has to do with safety. You know, a lot of the times as it progresses, they forget to eat, they forget how to eat. Sometimes patients with Alzheimer's can get violent, so it's important to know how to take care of those situations. Hygiene, we're gonna have to help out as well. It's like having a child all over again. So, and whenever you see that she's having trouble with certain things, just help her out. It does take a lot of patience, which is also why we recommend having a caregiver, because it can be a lot. So, and I know that you're very stressed out.
Who are we providing a caregiver for?
For yourself.
Oh,
Yeah, just so that they can help you out at home. Okay. Obviously, she can't be driving anymore. If she has to go to doctor's appointments, anything like that, you or a caregiver, whoever will be taking care of her, would have to do that, and we can talk more in depth about those situations. Whatever you decide to do, if you need to go home, talk about it. It's important for her to engage though with other people. But it's important to also not take her to crowded places, things like that, that will irritate her, that will get her agitated, okay? When it comes also with meals, don't provide everything to her at once. Maybe if you're gonna give her vegetables, do vegetables, and then do the chicken, and then do whatever, you know? So that it doesn't overwhelm her, because there's gonna be instances where she's gonna be very overwhelmed.
Yes.
Any questions?
No, not right now.
Okay, awesome. Well, I'm gonna have my pharmacist come in and explain the regimen. It was a pleasure. Again, if you have any questions, please give us a call, okay?
Thank you.
Thank you.
Hi.
hi.
Can I have your first and last name?
Yeah, it's Bianca Paz.
Okay, and date of birth?
June 24th.
Okay, so what I have here is donepezil. This medication enhances acetylcholine uptake in your brain. This maintains memory skills for a while and enhances cognition. Just remember that this medication does not cure the disease, okay? The most common side effects are headaches, diarrhea, and nausea. Other side effects are weight loss, hot flashes, arthritis, and frequent urination. The dose you will be receiving is 5 milligrams. You take it once a day by mouth. Your doctor may increase the dose after 4 to 6 weeks. Make sure you're following up with your doctors, okay?
Okay.
What else? Make sure you take this at bedtime with or without food. It doesn't really matter. If you miss a dose, it should be skipped and take it the next day at the same time that you usually do. Okay? This medication may take weeks before you see any improvement, okay? So don't get like, oh, it's not working. So just give it some time. Notify the healthcare provider or your doctor if nausea, vomiting, diarrhea, or changes in color of your stool, your bowel movements, or if new symptoms occur or previously symptoms just become like way more worse, okay? It's also important that you guys notify your doctor of all the medications you're taking, and if you're planning to take like over-the-counter medications, any herbs or any vitamins, make sure you confirm with them first, okay?
Okay.
And that's it. Thank you.
Thank you.